Welcome to the AUA News Inside Track podcast, an official podcast of the American Urological Association. Thanks for listening. Today's episode is part of the SAU AUA Urology Match Insider series, developed by the Society of Academic Urologists in partnership with the American Urological Association. The SAU AUA Urology Match Insider series provides medical students interested in the field of urology an inside look into the Urology Residency Match process. The Urology Residency Match is owned and governed by the Society of Academic Urologists and administered by the American Urological Association. For more episodes of this podcast, please visit www.auanet.org/podcast.
Hi, everyone, and welcome to another podcast episode in the AUA SAU podcast series. My name is Irene Choi, and I'm a current M4 at St. George's University School of Medicine. Today, we are joined by Dr. Jennifer Yates from the University of Massachusetts and Dr. Justin Hahn from the Smith Institute at Northwell. We will be discussing how to best prepare for your upcoming urology residency interviews and any tips and tricks for the best outcome possible. Thank you both for joining us today. Could you start by introducing yourselves and telling us a little about your program and your role in the residency selection process?
Sure. Thank you so much, Irene, and thank you to the AUA for inviting us to join you today. We're excited to talk about this topic since it's timely and everybody is going to be very interested in the interview process coming up in the next few months. My name is Jen Yates. I'm a urologist at UMass. I'm the residency program director, and I, in that role, spend a lot of time as well with our medical students at UMass. So thank you again.
Hi, thanks for having us. I'm Justin Hahn. I'm also a residency program director and a reconstructive urologist at the Smith Institute for Urology, which is part of Hofstra Zucker School of Medicine and Northwell Health. It's a little bit of a mouthful, but that's our official name.
Awesome. So kicking off, so our first section of this podcast is why interview prep matters. From your perspective, Dr. Yates, why are interviews such a critical part of the urology match process?
Well, I think, Irene, that this is an amazing opportunity, most importantly for medical students to get a real good feel for a program. We historically hear the word interview and we think that somebody who is interviewing for a job is in some way performing that job, but really a lot of the match process and the interview process is for the applicants, for the medical students, because this is a huge deal. This is 5 or 6 years of your life. This is a huge chunk of time that you'll be spending during those 5 or 6 years. It's essentially a new family that you're creating for 5 or 6 years. So I think what we really have to realize is more than just a simple job interview. This is a real opportunity for medical students to get to know the not only the program, but also the members of the faculty, the members of the residency that they'll be working with. So I think the stage of your life as a medical student is incredibly exciting, and it's so important to find a place that is a good fit for you. And this is the best opportunity. From a program standpoint, of course, we want to find applicants and medical students who are the best fit for our program. And obviously, every single program has a different definition of what is their best fit. But so it's definitely advantageous to both parties for interviews, but really this is all about our medical students and what we can do to get everybody into a program that is the right one for them.
All right. Dr. Hahn, what qualities are you looking for in interviews that may not show up on paper?
Yeah, I think this is a great question because as to build off what Dr. Yates said, this is really in some ways a two-way process. It's for us to meet you and for you to meet us. And I think and I'm speaking for myself, every program probably has a different viewpoint on this, is finding people that really fit our program, that will thrive in our program, and that can see themselves wanting to be there. It's a long process and it's a tough road, residency. And so we want people who are motivated, who are self-motivated, and also work well with others. So teamwork is critical in medicine. I think that's probably been hammered in from the first day of medical school, which is a little bit different than perhaps what Jen and I went through when we were in medical school. But it is a critical part, and those are sort of things that we're trying to look for.
You're
Gotcha.
absolutely right about that. And I'd like to just kind of reinforce that's why we're all here. I
Yeah.
think urology is just such a great field in the sense that the value is placed heavily on collegiality, camaraderie, teamwork. And I would never badmouth other specialties, but I think we lead the pack as far as urologists go. And so that you're right. You hit the nail on the head. That is truly what we're looking for in our resident applicants is people who are team players and who, a rising tide lifts all ships and is willing to get on board and help everyone out on the team.
Dr. Hahn, what does a typical urology residency interview day look like at your program?
So our program is in person, and I think I have to make that clear distinction. Probably, I would guess 40% are virtual and 60% are in person. That would be my guess. For us, an in-person day starts off at our grand rounds, showing up to our weekly grand rounds and really getting insight into what that day looks like. We do not, sort of put on a show or an act. We have our residents present cases, engage with us. And I think the applicants appreciate seeing what a sort of typical grand rounds looks like. Then we obviously have presentations from our leadership, from myself, from the chairperson, from my associate APDs, and there's a tour of the campus. There's a little bit of a fun activity, a get to know the residents type of activity, and that's really a nice opportunity for, I think the applicants have a lot of fun, and so do our residents getting to know each other. These are going to be your future colleagues and friends. And then we spend a lunch together and then an afternoon interviewing and sort of what's considered the formal interview process. And that's really, sort of a traditional format. An applicant, we have 2 interviewers per room. At our institution, traditionally, we've also had our rising chief residents or chief residents interview. And then, sort of the day ends after that sort of rapid fire traditional format. And, that's basically our day.
Dr. Yates, are there any trends that you're noticing, perhaps like more virtual components or multiple mini interview style questions? I know Dr. Hahn just touched on that.
Yeah, I think every program's a lot different as far as how they approach this. And I jotted it down. What a great idea to have applicants actually see your conferences in action. That's brilliant. We do not do that at UMass. We have kind of more of a traditional interview session. It's either one-on-one or two interviewers for the applicant. But I think maybe some trends that we're seeing, in addition to all the shakeup since the pandemic of going virtual, because obviously that was for every specialty that's interviewing, that was pretty much a departure from anything we've ever done before. But I think aside from the hybrid and the virtual interviews over the last few years, I think there's also a little bit of a trend going towards different means of assessing applicants rather than our traditional ways of just asking questions and having standardized questions. We've in the past, including last year, each of us picked a standardized question. It wasn't a classic question such as how would you respond in a difficult situation, but a little bit more organic, trying to get at people's interests and just lives lived and experiences. But I also think applicants may notice that some programs are focusing a little bit on skills. I've heard of some programs actually introducing a skills component to that. So show me your suturing or tying or other hands-on skills. I don't think that's common. I don't think that's likely to be seen across all of the programs and interviews, but I think that is definitely something that applicants may see going forward in the future as well.
Back to you. If you are advising a medical student on how to prepare, where should they start?
There are so many resources. You can get a little overwhelmed by this. And as somebody who's been a urologist for many years, otherwise you could read into that, I'm old. I'm not very good at social media, but I know that there's a lot of social media presence as far as just the standard ones that we often use. But also, I think there's some Reddit threads that you, as a medical student, probably know a lot better than I do, and some Google documents. I think also websites, of course. The general website that every program has can give the applicants a wealth of information as to who is who and what clinical interests are for those individual faculty. And what I would say is use all those other resources to crowdsource, ask other applicants, residents, medical students through those Reddit or Google documents, but also spend some time looking at the website, getting a handle on who the faculty are, what their clinical interests are, how long they've been there, what is the org chart at the institution. You want to go there knowing who's the chairman. If you're interviewing with the chairman and you don't realize, or chairperson, if you don't realize it's the chairperson, then that's a little bit awkward. So I think knowing the org chart of who's the program coordinator, they are as important as everybody else who's involved in the interview process. So knowing the names, knowing kind of the roles that these folks have played at the institution. You can ask your mentors at your own institution, the faculty, and I count residents strongly in that category of mentors as far as resources that you can leverage. Because I guarantee you, they did this a few years ago. They're going to know a heck of a lot more than a lot of the faculty know. They'll have some of the inside kind of scoop on the culture of a program and faculty at a program and just a lot of things that move and shake over time. They'll have a good handle on that, having interviewed recently. I would also say, as far as preparation goes, aside a totally separate means of preparation, aside from just looking at resources and learning about a program, is practice questions. And where the heck are you going to get practice questions? Because you have absolutely no idea what you're going to be asked. But I think just the act of practicing a question, even if it's not the content that's related to urology, to medicine, to anything else necessarily, in our kind of usual realm is going to be beneficial. So mock interviews, and we'll talk about that a little bit later, but just practicing questions, have somebody ask you questions, you have a family member, just to give you the opportunity to practice the kind of the pause. Oh, I don't really know how to answer that question. Practice what you're going to say if you don't know how to answer that question, which is perfectly fine. And just use that opportunity to leverage friends, family, colleagues, just to get into the kind of the question and answer and how you're going to manage that, even if it's not the content that you're practicing. It's more of just kind of the motions of doing questions in an interview setting. Because many of us, we interviewed for college, we interviewed for medical school, but that's it. We haven't interviewed for, quote, real jobs. So this is a new experience, and just practicing that, I think, is really, really beneficial. And then practice being on time. That's a hard one for me. I am horrible about time management. I am terrible about being aware of time. And I always think the rules don't apply to me time-wise, but this is not your opportunity to find that as an endearing quirk in your personality. This is the time where you want to be on time. So when somebody shows up late for the interview, people notice. Everyone notices. The program coordinator is annoyed because it just kind of threw in a little wrench in the works of already something that's kind of highly detail-oriented and well-orchestrated. So just be on time. So that's, I think, another way to prepare is just the professionalism that we all consider when we're talking about interviews, as the big broad category of what you can do in advance.
Okay. Thank you so much, Dr. Yates. Dr. Han, so I know Dr. Yates touched on this as well, but what are some common mistakes you see during interviews?
Yeah, I mean, I think the timely tardiness is definitely probably a mistake that almost inevitably happens, every interview season. But I would say one mistake, which is also preparing in some ways, is not knowing your application. Preparing is also preparing yourself and knowing your application well. If you've put something on there, most of us who go through this process do read quite carefully the entire application. And so we might ask you something that to you may be one activity that you did 3 years ago, but if you're putting it on there, we might ask you about it. And we'd like to know that if you're putting it on there, it's meaningful to you, that you're able to speak to that. So I think a common mistake is not necessarily knowing yourself, knowing your own application. And that is fair. It can be apparent. So that would be probably a piece of advice that I would have.
Wow, love that perspective. Okay. Dr. Yates, I know you also mentioned this, how your program is kind of stepping away from very common questions, but in your opinion, how should students prepare for behavioral questions such as the classic, tell me about a time you faced a challenge?
That is so hard, isn't it? Because you never know what it's going to be. That being said, if you Google along those lines, and again, this is in keeping with the kind of my belief system that the interview process is very similar to the interview process for any other job that you're going through or applying for. If you Google and look online, there's a lot of really great resources in general of preparing for interviews that have behavioral type questions like that. So when you think about all the other careers that we could have considered, many of them ask the same types of questions. And anticipating that we were going to discuss this today, I did look into it. And there's a number of resources with other specialties, medical specialties, and also other non-medical fields as well that really can help you prepare, because they'll have a list of questions and then kind of prompts to help you think about that. And so you can again, as I mentioned earlier, practice. And there's no way in the world you could practice all the questions that somebody can ask you from that kind of category. But what you are practicing is not the answer to the question, but how to manage it. Because if you ask me a question I'm not prepared for right now, I'm going to be a little flustered. I'm not really going to know what to do. But if you go into the interview expecting that might happen, and you've already practiced being a little bit flustered and you know exactly what you're going to say, for instance, oh, well, that's an interesting question. Give me a moment to think about a good answer for that. Then you're ready and you're not getting flustered and disoriented. So I think being prepared for not being prepared is the best way to prepare, if that makes sense. And I think it's okay to pause just for a moment and say, give me a second. In a very professional way, may I have a moment just to collect my thoughts? Because I think the interview is just inherently a nerve-wracking and difficult experience for anybody. And so give yourself a little bit of grace and a little bit of time to sit back and gather your thoughts and know that the person sitting across from you, or people, have been there too. So if they're asking you really tough behavioral questions, that's not very nice, but you'll be ready for it because you're anticipating and preparing for not being prepared. And I would also recommend, Dr. Hahn mentioned it earlier, keep it brief. And I'm noticing myself right now that I'm going on and on and on in answering your question. So an internal clock is also important to practice. Realize when you just continue to go on, and you may see a glazed look, you may see some cues from your interviewer, or you may not, but your internal clock, you can practice this in advance and say, aha, I knew this was going to happen. I have a tendency to do this. I'm going to go ahead and wrap it up. And then the last thing I'd say is be honest. The last thing you want to do is dig yourself into a hole of trying to relate something or explain something, or just answer a question that isn't completely honest. So within reason, I mean, we all know social norms, and we don't want to reveal things that aren't necessarily things we would reveal to close friends. Don't do that now. It's not the time. But just be as honest as you can while still professional. And if you aren't comfortable answering a question, simply don't answer it. There's very gracious and kind ways to not answer a question.
Okay. Thank you so much, Dr. Yates. I know, Dr. Hahn, you mentioned that your program is in person now, but do you possibly have any tips for virtual interviews, such as lighting, background, or attire?
Yeah, don't do what I'm doing right now, probably. I am probably not a great social media resource. So obviously there are people who have, special lights that give them nice lighting. I think, Irene, you may have one of those. It shows the generational change. But I think, obviously a well-lit place, look professional, have, your surroundings, if you don't have a blurred background, clean. We've seen people sort of have their bed and, maybe it's not totally made next to them in some virtual interviews when we were doing this. If you like having a nice bookshelf and you have lots of books, make sure you actually have read the books. It's not supposed to be eye candy. These are organic conversations, and I think what Dr. Yates was saying about being true to yourself and being authentic is really important. We want people who, we spend a lot of time together, and you spend a lot of time with your co-residents, with your faculty. We want to know that you're, sort of someone that we can get a phone call at 3 a.m. and, trust your judgment and, take care of patients and feel like we're in a team setting.
Okay. The next questions, two questions are for both Dr. Yates and Dr. Han. What types of questions should applicants be asking of programs?
I would say do not ask nothing. I know that sounds like it's not really an answer to your question, but even if you get to the last interview, let's imagine you've done 8 interviews and you think, I know this program inside out. I either love it or I hate it. Don't go and tell your last interview, all my questions were answered. I don't really have any other questions. Because even if that is a true statement and we just told you, be honest, that was the last thing we just told you, but be honest, but also be aware of how you are coming across if you say, I have no questions, because these are people who are trying to sell you their program. We're very proud of our programs. And the absence of questions sometimes at the end of the day is certainly welcomed, but the message that we receive is, I'm not really that interested in your program. So just keep something in your back pocket. And just, if you research the program, if you know the program, if you know the faculty, if you know the residents because you researched them or asked questions, then you can ask something that shows that you really know about that program. So I get a lot, and I'm sure Dr. Han hears this too. Where do you see the program in 5 years? And I want to scratch my ears out because I'm like, oh no, not this one again, because I've said it about 10 times already. But if you ask something like, Dr. Han, I'm really interested to hear about your experience working with a multidisciplinary team for your recon cases. Can you tell me a little bit about that? How does it work at your institution? Then you've shown that you have a genuine, well, it might not be genuine, but you have some interest in learning about the program, number one. Most importantly, number two, I have just shown Dr. Han that I know what he does. I don't think he's just some general person that I'm interviewing with. I know specifically who he is, what his interests are, what his passions are. And if I really wanted to go to the next level, I would do a little research and find out what his clinical interests are to a greater degree. I'd find in PubMed, I'd find something that he had done. Oh, this is his kind of subspecialty niche. And I would ask him a question about that. So you don't want to look like you're asking probing questions that are obnoxious, but asking something that shows, number one, you're interested, and number two, that you've done a little bit of research and you truly went above and beyond trying to learn about that program or that individual, I think really makes a huge difference.
Yeah, that's a wonderful answer. And I think in ideal world, that is the best that you could probably do. And I don't want to have applicants feel like there's a pressure to know every single faculty member and to be able to pull PubMed articles. That's tough. Absolutely, that does stand out. I think Dr. Yates is correct. When someone has shown that they know a little bit about us and have a personal knowledge of, say, what we do or maybe what clinical programs we have, that definitely stands out. If there's an area during the day, during the presentations that hasn't been touched upon that may interest you, for example, if you're interested in gender affirming surgery, or if you're interested in some specific, perhaps less common experience, asking about that can be a useful time to do that as well. And I guess that also is paying attention, which relates to what Dr. Yates was saying about, being prepared and paying attention to the program.
Absolutely. And I'm not telling applicants not to ask, where do you see the program in 5 years? I think that's a great question, but it's done so often that being a little bit innovative and thinking of questions that really probe a little bit deeper into the program and give you an opportunity to learn as well. And let's be honest, human nature is human nature, and people really do enjoy talking about themselves. You can argue that, no, I'd rather hear about the applicant, only the applicant. I don't want to talk about myself. That's not what this is about. But human nature is such that if someone asks you about your passion, my passion is upper tract urothelial cancer. Someone asks me about that, and I'm going to light up like a Christmas tree. So it's just human nature, and you're going to engage your interviewer to a greater degree if you can find something that is their passion and ask them about that as it relates to urology. I don't mean necessarily going off on a tangent and lying and saying that you have these hang gliding interests because that faculty member loves hang gliding, but more of the clinical interests. If you can kind of make that connection, people love talking about themselves and their clinical interests and their clinical passions.
Flipping the script a little, how can an applicant best assess a program during interviews to determine if it's the right fit for them?
I would say the residents are going to be the critical resource here. They're going to give the, sort of the nitty gritty And most residents, I would imagine, are quite honest. They've just been through the process. They understand, how it is, the pros and cons. And I would say also ask different residents. There are different levels of experience, and certain perspectives change over time. So asking junior residents, senior residents, chief residents, so on, even perhaps contacting alumni. As on our website we have a list of our alum. Some of them are maybe Googleable, so that's another resource if you're truly interested in getting kind of the inside scoop.
I was going to say residents as well. I think we're on the same page here. And I think you just kind of get a feeling for the culture of the residents and also how they interact with the faculty. Some programs are much more focused on the hierarchy, which is, there's absolutely nothing wrong with that. I think that really, it feels like home to a lot of people. I was raised in a military household, so hierarchy always spoke to me. Some people feel like they're a little more comfortable with a more informal environment. So everybody's different, and you're going to see the interactions with residents between each other, with faculty members. And then another little secret resource that I think we underutilize is the program coordinator, or other associate to the program coordinator who may be helping with that day. They likely, I know our program coordinator has been we've been together now, partners for, gosh, more than 8 years. It's definitely been more than 8 years. And she knows this program inside out, and she could probably tell applicants a heck of a lot more than I could about a lot of different things. So she's kind of our best kept secret as far as resources go for getting information about a program.
Dr. Yates, what's something applicants do that really impress you?
I spoke to it a little while ago, so I don't want to beat it too much, but researching the program, knowing the program. There's been times where somebody interviewed with us and actually was a little bit confused, and it's understandable because the state of Massachusetts has a number of programs and some of the names sound familiar, and thought it was a different program. So that's a little bit of a faux pas. That's an extreme example of a faux pas, but knowing your program. And then something else that really stands out to me as far as kind of a do's, don't, and what impresses me anyway, and I might just be a simple person, but is seeing medical students who are applicants and interviewing being kind to one another, and not just for show, but just genuine kindness. And sometimes a lot of times, because again, people who are applying for urology are usually pretty awesome people. But when you see somebody these are people who are competing for the same highly desired position, but when they're collaborative and they're kind to each other, I think that is so meaningful, because that speaks so much to the values that we're looking for. And that's also true. I know we're talking about interviews today, but on your sub-I, on your rotations, we've had this year, we're very fortunate. We've had medical students who are just unbelievably supportive of one another. And I'm just so impressed by that. And I think that's a quality that's often hard to assess, but when you see it, and it's not a staged or contrived, and it's organic, I think that to me is just incredibly meaningful.
Okay. Conversely, Dr. Han, what are some red flags during an interview?
Yeah, I think I think we all hopefully understand how to be professional, but some of that is, showing up on time, being prepared, dressed appropriately, behaving kind to others. I think in terms of, and if you happen to have a virtual interview, I think it's important, and this is not from my experience currently, but in past experiences, making sure you're still engaged. In virtual interviews, it's easy to kind of drift off, or maybe during the presentation, not pay attention. I think that gets noticed, certainly. And so being engaged, and similarly in live, in person, being engaged, we're giving a presentation. And if someone's sort of nodding off, which has actually happened before, that's something that will be noted. So those are general rules in terms of professionalism. I have a personal pet peeve. Again, I think you may have picked up on this before, of knowing your own application. If you put something, for example, that you like a certain type of music, or you like a certain type of food as your hobby, and I ask you about it and you cannot speak about it at all, that's, to me a little bit of a red flag. Then I'm wondering, how authentic are you as a person? How authentic have your experiences been, and your genuine interest in doing the things that are sort of there in the CV?
Absolutely. And I would add to that my own personal fault, which is late. I mean, I think that is one of the biggest red flags. Now, if there's some sort of natural disaster like a snowstorm and there's no way to avoid it, that's fine. But if you just didn't get out of the hotel early enough, I think that's problematic. I also find it a little bit troublesome when the entire interview is dominated by the applicant talking and I can only get one or two questions in. I see that as often a red flag of an inability. Less so worried. I'm not worried about myself getting my questions across. I'm more worried about how is that person going to interact as a physician with patients, with their colleagues, if they don't have the ability to be quiet and to listen and to then respond, but instead dominate. I think that's concerning. And I also would say, I think mock interviews, if you do as many mock interviews as you can possibly do with your mentors, with the residents, with your colleagues. We had our medical students a few years ago who wanted to interview each other, which I thought was amazing. Ask people how you come across. Make sure you're not coming across as condescending or judgmental. And a lot of people, myself included, often don't realize how they're coming across. And it's a shock. And it's a great shock when somebody actually cares enough about you to say, hey, by the way, this is how you came across, the way you said this or that. That is a real gift that someone's giving you when they're critiquing your interviewing style. So ask people, how does it sound when we're having a conversation and, in a mock interview type setting? Do I sound respectful? Do I sound condescending? Do I talk too much? So I think just kind of those nuances of conversation are important.
How should applicants handle difficult or unexpected questions?
Well, I think that's a broad category of questions that some may be considered inappropriate. I would first say the SAU has, and so does the law, has very defined categories of what we can and cannot ask you as an applicant. And you should know that. And what I would recommend before the interviews is go on the SAU website and read just kind of the rules of engagement for interviews, because I think it's very important to know questions that you should not be answered or asked. And faculty and residents know that too. And I don't think it's very often that there are violations of those types of questions, but just know what is and is not appropriate. So that I would put into the category of unexpected. We already talked a little bit about difficult questions, and I would say that in the moment, be professional and say, "Boy, I'm not sure I have a good answer to that. Give me a moment, and I'll think about it." And then it's fine. Silence is okay. I'm somebody who struggles with silence. I really do. I need to fill it, and that's not a good trait. So if you're somebody who's like me, practice silence. It's okay to pause for a moment, let your brain work, and then answer in a very kind of in a manner that you've had an opportunity to prepare. And also that simple, I'm not sure I have a good answer to that, could also get you out of a question that you find to be a little bit inappropriate. That being said, I would warn you, anything you put on your application is fair game. So if you're going to be uncomfortable, if somebody asks you about something that's on your application, that's a problem. Don't put it on there. So make sure that everything on your application, as Dr. Hahn said, is genuine, but also is something that you feel very comfortable discussing. Because once you put it out there, even if it makes you uncomfortable to discuss it, that should give you an idea that let's just leave that off. The last thing you want to do is put yourself in a situation where you're not comfortable discussing something that's on your application.
Yeah, I would agree with all of that. I think, and also that holds true for if you bring up something during the interview or during the conversation during the day, and someone asks a follow-up to that that might be slightly more personal, you could sort of take that either way. And I think that if it becomes something that's uncomfortable for you, certainly taking a moment, saying, let me think about that. That's something I hadn't thought of, or, just giving yourself some space and some time. And I think also understanding that, that is also in some ways an individual in front of you, and people sometimes can make mistakes and maybe ask questions that in hindsight they probably wouldn't have wanted to ask, and so on. Just being gracious about that as well. Nobody, I think, I can't speak for every residency program, but most people in urology we're not out to try and get people per se, and it's a friendly field, and so having a little bit of grace for yourself as well as for the other individual.
That's a great point. You're absolutely right about that, because we're all trying to do our best, and it's a very artificial environment for all of us to be interviewers and interviewees. So it's tough. We're all learning together.
If you could give one piece of advice to every urology applicant before their interview, what would it be?
I would say practice, practice, and practice some more. I don't think you can have too many mock interviews. And it doesn't have to be the same thing over and over again. You think, what's the value of that? But even having your parents interview you, it sounds silly, but that use that resource. They can ask you questions. They can look up questions online, the behavioral questions that we're so nervous about, and just practice answering the questions, so that you're training yourself to be able to pause and think rationally in the moment when it's going to be a little bit more uncomfortable when you're in that true interview setting. And then we, at UMass, I like to do mock interviews with our medical students. And historically, we had only done live mock interviews, and I have them come in dressed in whatever they're going to wear to their interviews, just to be able to say, oh boy, that that might it would look a little bit better if you were to wear something that doesn't necessarily conflict with the background or is so bright, or it's good for us to be able to look and give you a little bit of feedback about what you're planning to wear to the interview. And I also, now in the era of virtual interviews being historically now almost half of the interviews in the last couple of years, I'd like to do a virtual mock interview as well, or at a minimum to see the background that you're going to use. And Dr. Hahn had spoken to that earlier. This is not an opportunity for us to kind of peek into your life, but it can be so distracting if there's something, a picture, or as you had mentioned, a bed that's unmade. It sounds so trivial and silly, but it can be so distracting that it's hard to focus on what is really important, which is your interaction with the applicant. If it's a busy background and I'm looking here, I'm looking there, I'm seeing people walking behind your curtains outside. So I think having that, the live interview, and also the mock virtual interview can be very beneficial, since you're likely going to do some of each of that category. And the goal of the interview, the mock interviews, is for us to look at the optics and just say, yeah, that looks great, or no, why don't you kind of change your angle a little bit, move the camera here, the background's a little bit too much. The content, so asking you questions that we truly believe might be asked, to give you the opportunity to answer real life questions that might be asked, and also just for us to give you feedback about your interviewing style. So if you're staring into the camera the whole time unblinking without any facial expressions, that might be perceived a certain way, and we know you're such an animated, interesting person, and that's not being conveyed. We can give you that feedback. So we're looking at just the silly background and clothing. We're looking at the content of your interviews, the questions that we're asking you, and we're looking at your interview style, your interpersonal interview style. Stop talking so much, slow it down a little bit. You're talking too much, you're talking too little, you're talking too fast, not enough eye contact, too much eye contact. It's amazing how much goes into all of that. And so practice, practice, practice with as many people that are willing to do that with you, I think would be my biggest piece of advice.
Okay.
I think practice is wonderful because it helps you become more relaxed. And I think, it's a long process, and try and go into it with a mindset of, feeling relaxed and feeling sort of excited it's a real unique opportunity. We have all these different things in medical school that we get to see that other people don't get to experience. And one of those things is kind of an opportunity to travel around the country, hopefully, and see different programs and meet different people that eventually, hopefully, will also become your colleagues. And I think that's kind of fun in some ways. It's hard to be in the moment and think of that as being fun, but as much as you can to kind of set your mindset of being, I'm looking forward to this. This is going to be sort of interesting, and trying to be relaxed, because I think that body language really shows. And part of practicing, I think, helps with that body language, and that adjustment and that mindset, because I've done this a bunch of times. I've been in an interview type of environment, and I can kind of be myself and not get too anxious or whatever it may be.
Okay. And on trend with former episodes of this podcast, what is one myth about urology residency match interviews that you would like to debunk?
I think the one myth that I would like to debunk is that we know what we're doing and we've got this down. Just like the applicants, we are constantly trying to do better. We're trying to be better interviewers, we're trying to be better in general, just urologists. So I think realize that when you're interviewing with us, that we're always trying to make this a better experience for you and for our residents. And so while it seems like I think people who have arrived, so to speak, in our faculty have all the answers and they've got this interview thing down and they have all their ducks in a row, not necessarily true. So we're innovating too. We're trying to get this right. We're trying to do our best and get some really good questions, but also put you at ease. So just know that we are not perfect, and we're just trying to make this the best experience for you. So relax and just try to enjoy the ride. It's easier to say when it's over. Look back and you say that actually was kind of fun. I met a lot of great people. I went a lot of really cool places. It's hard to enjoy it when you're in the moment because it's so nerve-wracking, but it's going to be, when it's all over, it's worth it. And it's just the ride itself is fun.
Yeah, I think this is a really tough question because I don't really know what the myths are these days. We're quite removed from this process. I would guess one myth would be that there is sort of a standard approach, either to the interview or to how applicants are ranked or how they're selected. I would say that there is no standard process in terms
Mm-hmm.
of how interviews are viewed and how people rank people and how people discuss people and what parts of your application are valued or are less valued. It I think is very individual. So if that is a myth, which I don't know if it is one, I would say that there's probably no secret sauce or magic formula that you can apply broadly. So I would ask you, Irene, is there some myth that you would like that you think that is sort of floating out there in the ether that you would like us to maybe give it an opinion on?
Oh, Dr. Hahn, tables are turned here. I
Wow.
love it.
Well, I would say that, I think as medical students, we want to have the answer in, being on sub-Is and rotations right now, like we always want to have the correct answer to any questions that are being asked of us. So I would really say it's a mixture of both that you, Dr. Yates and Dr. Hahn, that you guys have debunked just now, where it's you guys have everything under control. You guys know everything, but also that we are supposed to have the correct answer, I think it's just a mixture of both of that. Like we're all very, very nervous going into this whole process. We know we love urology, but how do we show that we are ready to give it all and that we are the right fit for this program?
Yeah, and I think that's the myth that it's just not true. And you have over 100 different programs, 100 different cultures, different values in terms of what people are looking for, and so there's no right answer. And that's really why it's kind of as we were talking about before, an opportunity for you to interview the program and determine where the best fit is, because ultimately that's where both parties are going to thrive, right? We want you to thrive, we want our programs to do well, and that's really that happy marriage, for lack of a better word, of the applicant and the program.
Yes. And I know you guys have really, really talked about this a lot, but any additional resources, books, websites, elsewhere for tips and tricks?
Yeah, absolutely. I think we talked a little bit about you can just look online for interview type questions for any type of professional interviews. And for lawyers, there's a lot of great resources out there as well. One resource that I would recommend is Residency Interview Questions, the AAFP. Has a really neat kind of question bank, and it's not necessarily just relevant for family practitioners. It's for all medical specialists. And then Backtable Urology is a really great episode. Dr. Shaw, Dr. Hampson, Dr. Bottolato gave a really great interview about similar questions as well. So leverage that as well. And then, of course, the SAU and the AUA websites are great resources. The SAU typically has some webinars for applicants and also for program directors that are very useful. The timeline is published there. So pretty much any of your general interview and residency application timeline and other questions can be answered on one of those two websites. Usually SAU is a great resource for that.
Yeah, I would echo and give a shout out to the AUA resources. There's a medical student education committee. They have in the past put out some podcasts and sort of webinar type of things out there, very similar, how to match, how to interview. And also, I would say that if people aren't on the UpSquad app through the AUA Future Program, which is something that the AUA Health Advancement Impact Committee has kind of put together, they have a monthly sort of I guess, medical student Zoom session where you get an opportunity to kind of talk to the various faculty and different program directors. That's a nice resource as well. So there's a lot out there, and it's fairly easy to find through all of these institutions and organizations. So, just do a little quick search.
And your local AUA sections as well. I think there's a lot of opportunity for mentorship there. As the interview season approaches. It's a smaller scale than the AUA, and there's a lot of other groups as well that are affiliated with urology, such as Urology Unbound and Society of Women in Urology, who often will provide resources to mentor you through the interview process. So a lot out there that you can leverage.
Okay. Oh, and finally, do we have any closing thoughts?
Enjoy the ride. It's so hard to enjoy it when you're in it. If you could only know how this story ends, it would be so much more fun. But know that the statistics are in your favor. Just about every one of you is incredibly competitive and really have a lot to offer programs. So just really rest on that and know how valuable you are and how excited we are to meet you in a few months.
Yeah, absolutely. Good luck. And honestly, congrats on making a decision on what you want to pursue. Urology is an awesome field. So, we hope to meet you and become part of the community.
Okay. Well, thank you both so much for taking the time to share your insights today. I know our listeners, especially those preparing for the urology match, myself included, will find this incredibly valuable. For anyone who wants to learn more, be sure to check out the AUA resources on interview prep. Once again, thank you, Dr. Hahn and Dr. Yates, for joining us today and sharing your expertise. To our listeners, good luck this interview season. You've got this. Once again, my name is Irene Choi, and this has been the AUA SAU podcast. Thank you for tuning in, and we'll see you next time.
This has been an AUA News Inside Track podcast. To hear more episodes of this podcast, visit www.auanet.org/podcast.